Senator Murray and I began leading this committee in January of last year, and at our first hearing on January 21st of last year, I laid out 3 priorities for the committee over 2 years. First, fixing No Child Left Behind, which we've done, thanks to you. Second, reauthorizing the Higher Education Act, which we're working on. And third, something the House of Representatives calls 21st Century Cures. We call it our Biomedical Innovation Project, but we are talking about the same thing, how to get these cutting-edge drugs, medical devices, and treatments into Americans' medicine cabinets and doctors' offices more quickly, at a lower cost, without changing the gold standard for safe and effective approval. There has never been a more exciting time in medical research than now. We're talking about actually curing, not just treating cancers, using 3D printing to help doctors replace knees. And even in one case, the FDA has approved a drug to treat epilepsy that is made by 3D printing. At the White House last January, the President introduced a young man whose cystic fibrosis has been cured by taking a new medicine every day. It was at that White House ceremony that the President announced a precision medicine initiative designed to promote personalized treatment that takes into account an individual's genes, environment, and lifestyle. I attended that ceremony, and I discussed with the President later his initiative, and I told him that we would incorporate his initiative into our biomedical innovation agenda. The House was making rapid progress on 21st century cures, so I said to the President we should be able to get a result this year. Since that time, the President has announced a cancer task force that Vice President Biden is leading to work up to speed treatments on cures for cancer. And the House has passed its 21st Century Cures legislation. Here in this committee, we've held 10 bipartisan hearings on the Innovation Project, including 6 on improving how our electronic health record systems work. We've had 5 bipartisan staff working groups working for about a year who have held more than 100 meetings and briefings. These discussions have produced 50 different legislative proposals. Every one of these bills has bipartisan support. Today we're going to debate and vote on the first group of these, 7 bipartisan bills that contain about a dozen of these 50 proposals. We're going to have an open process, which means that every senator, regardless of party, will have a chance to participate, a full opportunity for discussion and amendments. That worked very well for us throughout the process of fixing No Child Left Behind. I expect it to work well again. We have a second markup scheduled for March 9, and then a third on April 6. My expectation is that during these 3 markups, we'll consider all 50 of these proposals, and then when we've finished in early April, they'll all add up to bipartisan companion legislation to the House-passed 21st Century Cures legislation, and will include support for the President's initiatives in precision medicine and cancer research. The 21st Century Cures Act includes $9.3 billion in mandatory funding over 5 years, mostly for the National Institutes of Health. Several of the President's other proposals also involve mandatory funding, and several members of this committee have talked with me about their support for mandatory funding of some of the proposals. Here's my view. As one senator, I'm willing to consider additional advances in support for what I would call an Innovation Projects Fund. These would be a limited number of high-priority initiatives which would give the director of NIH the authority and ability to harness extraordinary opportunities. These would be initiatives that have a beginning and an end. They would jumpstart important work. I have in mind these 5: precision medicine, the cancer moonshot, the brain initiative, big BioThink awards, that is grants for each one of the 28 institutes for the biggest ideas, and the Young Investigator Corps. We may be able to pay for these initiatives in our normal appropriations process, but I'm willing to consider using mandatory funds for these initiatives. Because of our budget deficit, I believe we need to find that funding by reducing existing mandatory funding. And as a practical matter, there are not bipartisan ways to pay for such an innovation fund through mandatory funding in this committee's jurisdiction. So I would propose that we deal with this innovation fund that I have described and how to pay for it when the bill comes to the floor. We will have to decide what programs we want, how we will pay for them, and do that on the floor. Last year, we had great success in this committee by following the advice that Senator Kennedy and Senator Enzi used to follow. And that is, let's find the 80% that we agree on and work on those things first. We also reserved for floor debate the most controversial measures because we knew that in order for those to succeed, they would need 60 votes. And most important, despite our diversity of views on this committee, we were determined to get a result. We did then, and I'm equally determined that we should do that here. The House has done its work on its 21st Century Cures legislation. The President has made his proposals for precision medicine and for cancer moonshot. We have worked for a year to produce 50 different bipartisan legislative proposals. The Majority Leader, Senator McConnell, has told us that even though it's a presidential election year, he's looking for important ideas that have bipartisan support, that help many Americans, and that the President will sign. And I can't think of a single piece of legislation in 2016 that fits into that criteria better than this one. So today we will mark up 7 bills. The first introduced by Senator Bennett, Warren, and Burr and Hatch. The second by Senators Burr and Franken. The third by Senators Baldwin and Collins. Then one introduced by Senators Kirk, Bennett, Hatch, Murkowski, Isaacson, and Collins. Then one by Senators Isaacson and Murphy. Then a bill introduced by Senator Murray. And finally, we will mark up a bill introduced by myself and Senator Murray on health information technology that's been co-sponsored by Senators Bennett, Cassidy, Hatch, and Whitehouse. Senator